About half my day is taken up with seeing dogs with skin problems. Dogs can get skin problems, and the most common skin problems are flea allergy, where they itch their butt. If they have red infected ears and itch their butt, it might be food allergy. If they chew at their paws, it could be allergies to pollens and molds. So if they chew at their paws and have infected red ears, then it could be allergies to grasses, pollens, and molds. Well, Bella is a rescue. Bella. And she's a very young, cute dog. And she came in with just horrendous infections. It's much better, but you can see she has these little ulcers all over her skin, and it's in her inguinal areas, or flanks. See that? Let's get a light there. You can see all that weird inflamed area. You can see inflamed crust under her inner armpits. You can see inflamed crust in the inside of her ears. And you can see her pads of her foot are just very dry and crusty. These type of distribution patterns are similar to what we see in what we call autoimmune diseases. So usually what I do is I usually get a swab, and I swab the area, and then I put on the slide, or I press the slide right up against the area, and that actually usually gives me a better picture. And so I do that on moist areas, and I get kind of you'll see a film on the slide, and I'll stain that, and I'll look for bacteria and yeast. We'll see if that's part of the cause. But really what I'm going to do is I'm going to do the biopsy along with these other tests to see what the real cause is.
Here's some alcohol.
So this is the dextromethorm. We give it IV, and it's got a little torb in it, so this needle will go right in the vein. So we usually fill for a vein right in here, and so we've got the vein there, and we're gonna put the dextromethorm right in. I'm so sorry. You're a good girl. You're a sensitive girl. You'll get real sleepy in a few minutes. I'm sorry. So, and then that'll allow us to get the biopsies. You want to go to some fresh areas, but on the margins, so we'll probably go in the margins on one of these ulcers. So this is a biopsy punch. It's just a surgical blade in a circle so that we can use it to push down into the lesion. So we're going to try to get it on the margin. Here's the abnormal skin, and here's somewhat normal skin, and here's a little ulcer. So we're going to push it down into this area. And what it does is of course it bleeds, but it'll give us a representative sample of that tissue, so that the pathologist hopefully can tell us what it is. So then what we do then is, and we don't prep it much for this disease because we want to get it, we want to get the whole crust and everything. So I'm taking the little plug, we call it, and that's enough tissue to get a good sample of what the disease is. And you can see the hole there. That's what it came from. So we're going to put a little suture into the area.
That's yours.
There it is. Close it up. It only takes one suture. And we close it up with a skin suture, and then it'll come out in about 14 days. and it's got hair and stuff on it. It's not, biopsies aren't as sterile as a regular surgery because, especially in this case where we're biopsying infected tissue. So we drop the biopsy piece of tissue, we drop it right down into the, easier said than done, but drop it right down into the formaldehyde so it fixes it so that we can see what the pathologist says about it. And here's the other one. So that's all there is. It doesn't look like much, does it? And so we'll do a crack pad too, and we'll see if we can get a sample. This poor thing's going to be painful on this pad. So we're going to take this sample, a core sample there, and also send it in. I'm going to put that right into the biopsy jar along with the other tissue samples. So now they all go to the lab and they'll see why this darn poor dog has got these terrible lesions. So what I'm going to do next is this the antidote, amosidan, to the dextromethorphan, and I'm going to give it IM. And sometimes we give it, you can give IM shots. You don't want to give it an IM shot over the bone, but you can give it in the muscles of the back leg, or you can give it in the back. And he's got such big muscles, I'm going to use the back leg and put it right in, draw to make sure no blood comes back. So we don't want to really give it right in a vein. And then, and I'm sorry, it's her. And give it to her right in the muscle, and then she'll start waking up. And you can see Bella now is standing up awake. She's got a little bandage on her foot where I biopsied her, and she's going to go under a cage. And so the antidote worked good, and still kind of wobbly, but and she's feeling pretty good. She's got a nice little pink blanket to lay on. Thanks, Bella. I hope you feel better. So when we get our results back, we can see that it comes in a big bunch of long words like this. So it says these changes are most consistent with NME, or erythema multiforme. In most cases of erythema multiforme associated with a drug reaction, vaccines or drugs, and it can occur in any area, but truncal lesions are most common, especially form the glabrous skin of the inguinal region and the axillary region and the ears and the axilla. So this is probably what's going on with this little one, and that means it's autoimmune. So what vets do is we look at this, and if it's try to rule out bacterial infections or yeast infections or other parasites, and in this case all these big words means it's autoimmune. And what autoimmune means is it's usually responsive to prednisone. There's other drugs that are much stronger, but that's one of the ones we use. Well, I hope you understood what I was explaining, that I had a dog that came in with weirder lesions than normal. Usually I see dogs chewing on their butt, and that's flea allergy, and you can actually see the fleas on the tail head or underneath. If they chew on their paws, that can be allergies to pollens and molds. And if also their ears are red and inflamed but not goopy, sometimes that's also due to hay fever or pollens and molds allergies. But food allergies are generally when they chew on their butt or all over their body, and their ears are real infected, especially in labs, and goopy. So we rule out those kind of things. We first treat for fleas on almost everything, then we eliminate any allergens in the food, such as wheat and beef. The most hypoallergenic foods are fish and potato, also venison and potato and rabbit and potato. So with skin problems, you always want to go for the easy ones, fleas and food. And then if it's, and especially if it looks like it does in this dog, where it's armpits and it's flanks, not flanks like I said in the video, because that's more the inguinal region, and I made a mistake there that I realized. But if you right in the up in the groin, that's a better word, groin. If you got inflammation of the groin and the axilla, the armpits, and the insides of the ears, and it just doesn't fit any pattern, sometimes we want to take a sample, because we just don't want to use, well, you can use a prednisone as a trial thing, and if it gets better, then maybe you don't need the biopsies. But
it's always nice to know exactly what's going on. So when we gave sedation and we took the little pieces of skin off the groin and also the pad, then we sent them in and they gave me that report that said it's erythema multiforme probably, or NME, which is another autoimmune disease. But to the client, and especially this old dog, it's just a rescue. It doesn't mean very much because they can't afford a bunch of drugs, but I told them prednisone was cheap, and if it responds to prednisone, that's great. We can save this little dog. So where it looks much better, I'm so happy we did it, and that the dog's gonna have a good home. But anyway, yeah, check out if your dog has allergies, ear infections, and skin infections. Try to feed it the least amount of allergens you can, which is more of an organic, holistic, no wheat, no beef, no glutens, and you got to really be careful because some dogs are allergic to chicken, some are allergic to beef. So fish and venison and rabbit and potato are the least allergenic. And by the way, that's what I wrote my books about. Dog dish diet and feed your pet to avoid the vet is all about feeding food that has less allergens in it and causes less skin reactions. So if you want to try to do this on your own, then you can get the books and use flea control and feed a limited ingredient diet, either by talking in my books, or talk to your vet, or talk to your knowledgeable person at your pet store, and they can lead you to the best foods.